There is much controversy surrounding the issue of mandating the human papillomavirus vaccine to young children. The human papillomavirus, referred to as HPV, is the most common sexually transmitted infection and has been linked to certain cancers such as cervical cancer in women and throat cancer in men. Pediatric healthcare providers in general are advocating mandating HPV vaccines universally. Parents, however, are soliciting for full disclosure of the risks and benefits of the vaccine and the right to choose for families whether or not they receive the vaccine without interference. Pediatric healthcare providers feel that the only way to understand the true benefits of the vaccine is to institute universal and widespread uptake of the vaccine. They're saying things like, give me some hints, give me some info, give me the means to educate the parents. Surveys show that pediatric healthcare providers lack the knowledge to effectively communicate with parents and children on the benefits to receiving this preventive vaccine. How can we expect parents to comply with the recommendation when pediatric healthcare providers are not even on the same page? Parents express concern over the short and long-term health effects as well as the psychosocial impact it will have vaccinating against a sexually transmitted infection in their prepubescent child. Parents have doubts about the pediatric provider's knowledge versus hearsay. For example, one of the rumors is that if a child receives the vaccine, it will promote promiscuity and give a false sense of security against STIs in general. How experts present the knowledge to the parents will greatly impact their perception of the vaccine. Since the vaccination has only been available to consumers since 2005, many pediatric healthcare providers have not been adequately educated on the risks and benefits. Providers must seek their own education through seminars, lectures, videos, and research articles from public health organizations. Parental education should focus on the fact that 70% of cervical cancer is caused by HPV. However, parents must also remember that HPV is an STI and that they must create an open dialogue with children about sex and not be in denial. Through a study performed by the National Institute of Health, parents demonstrated more reception to vaccinating their children after viewing a video tutorial. Nearly 200 parents were surveyed and asked if they would vaccinate their child by the age of 15. The question was asked both before and after the video tutorial, and the percentage of people accepting the vaccine for their children nearly doubled. Parents must know that children cannot be vaccinated against their will due to the 1905 Supreme Court ruling of Jacobson v. Massachusetts. Not only do pediatric healthcare providers and parents need education on the vaccine, they need instruction on how to communicate with each other and their children. Have you been vaccinated? Would you vaccinate your 9-year-old son or daughter?